Hi everybody, my name is Magdi Abdelhamid, professor and chairman of the cardiology department Cairo University and the chairman of the working group of heart failure, the Egyptian Society of Cardiology. Welcome to the 23rd heart failure annual meeting of the Egyptian Society of Cardiology. And this meeting we have a distinguished group of experts from European Society of Cardiology, the Heart Failure Association, and from different Arab countries, and have the pleasure to welcome my dear friend and brother, Professor Feras. He is the chairman of the cardiovascular department and the head of the group of Advanced Heart Failure and Transplant Center in Cleveland Clinic, Abu Dhabi. He's one of the experts in the region heart failure, and I would like to ask him two questions. The first question is your impression about the meeting regarding the program, the venue, everything related to the meeting. Professor Feras.
Thank you, Professor Magdi. It is again my true pleasure to be here with you at this meeting for another round. It is an honor to be part of this meeting that is clearly now the oldest heart failure meeting in the region, and that has been around for many, many years, addressing the issues related to heart failure management and educating physicians in Egypt and in the region on the importance of appropriate diagnosis and management of these patients and hope to improve their outcomes. The meeting, as always, is fantastic. I see that the program is very comprehensive and well-rounded and covers all aspects of heart failure, from the prevention to early diagnosis and then finally to management of earlier but also later stages of heart failure.
Dr. Feras, today we enjoyed your presentation regarding patients who are intolerant to heart failure disease-modifying agents, the four pillars. So my question, how to improve the implementation of the guidelines in the daily practice and your advice for patients, advice for physicians who are taking care of heart failure patients to improve the outcome of heart failure patients?
Thank you for the wonderful question, Professor Magdi. As you know very well, heart failure patients are increasing in numbers across the entire world, and our region is no exception. And when you look at the heart failure population, the majority of heart failure patients are actually lined up in the earlier stages of heart failure, not the advanced stages, which means that we really need to do a better job managing them in those earlier stages so we stop them from progressing to the advanced stages. And the best way to do this is by utilizing guideline-directed medical therapy. It's extremely important that we do a better job with these patients early on so they don't continue to advance to later stages where they will need significantly more resources that our healthcare systems may not be able to handle, especially in our region. So the best way to do this is to continue to educate, not just the physicians, patients, families, and even the public on the importance of these medications as far as prevention of progression of heart failure, but also treating it in the earlier stages so the disease is contained and is not progressing further. I don't see any other way than education. And in addition to education, which will lead to improvements in implementation of this medical therapy, it will also lead to establishment of more heart failure clinics. We need a lot more heart failure clinics around the region so we can improve the utilization of these medications, because again, if patients get to the advanced stages, then you need to send them to advanced heart failure centers, and those are extremely rare, especially in regions where the resources are limited.
Thank you very much for your excellent answer. And again, thank you very much for your excellent contribution to the meeting. Thank you very much.
My pleasure.